Today's teacher in the classroom is Dr. Thomas Levy, MD, JD. So today we talked about adrenal fatigue, adrenal insufficiency, and how we can reactivate our adrenals. Now, Dr. Levy is not an endocrinologist, but he knows enough to be dangerous. Let me just put it this way. He's learned about the benefits of low dose hydrocortisone compared to a steroid. It's a hydrocortisone, which mimics cortisol. So if you want to learn more, you need to go to whenyouneedafriend.com. Both the Facebook and YouTube classes, this is the recap, will be taken off the air because it's not information that they want on that. That's why you need to come and watch the classroom live. You can also go to BitChute and Odyssey. By the way, like and follow me on BitChute Odyssey. We're going to be doing the class. We're going to be broadcasting live from whenyouneedafriend.com. So please subscribe. Let's get ready to start being able to, if we want to keep it on Facebook and YouTube, we can keep it there, but we can say whatever we want on my website at whenyouneedafriend.com. So please subscribe, tell all your friends to subscribe. We're being suppressed, we're being censored. And so we're doing everything we possibly can so that this information will continue to be out there. Do whatever you can. Whether you agree with Dr. Levy's position or not, it would be great for you to research it. I know that I started taking a small dose of hydrocortisone, and I'm already experiencing some symptoms that have required me to lower my thyroid medication that I've been on since 1996, 98. So it's doing something. I don't know what yet, to be continued. As I said, it's too early to tell, but with Dr. Levy and what's happened with him, he is just absolutely excited about getting this information out so that you too can decide if this is something you want to take to your doctor or not. And keep in mind that we have a link. I'm going to link in the description several things. The roadmap to health. I want you to know that we did a workshop, a 6-hour workshop. If you want to learn what Dr. Levy is saying, you can purchase your own copy and you can air it and listen to it over and over and over again. So that's one thing. The second is the article he wrote about hydrocortisone. I sent that to my doctor before going on low doses of hydrocortisone, and he was willing to prescribe it, so which is good. And again, I'm just sharing, I'm being honest with you. I don't like taking drugs. I don't take drugs of any kind, pharmaceuticals especially. But when I can reactivate my adrenals short term, use a drug so that long term, as I change my life and reduce stress and eat even better, all those things can help your body return to natural health, to its optimal health. And so let me know if you're doing that. So check out the article. If you want to purchase the Roadmap to Health with Dr. Thomas Levy, also tell your doctors and let me know by emailing me at lily@whenyouneedafriend.com. We're going to be doing a workshop just for practitioners. It could be ND, DO, anyone who can lay hands on someone and helps them with their health. That is for you. So inform your practitioners, your doctors, your NDs, your chiropractors, that this is something that they can use to educate themselves, to learn how to help the body differently than what they learned in school. And so, this is, like I said, to be continued. But most importantly, you be your own MD. You be your own MD, your own medical detective. And don't let anyone tell you that this is truth, this is not truth. Research it. That is what's important, so that you can be your own best advocate. And please remember, I'll be right here. I want to hear if you've done this protocol and what you are doing to get better, you can email me at lily@whenyouneedafriend.com, or you can post your comments on the description in the comment section below. And please remember, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Mwah.